Medical Science Liaisons. Everyone wants to be one, but what separates the good from the great? In 2025, the MSL role is more competitive than ever, and breaking in can feel almost impossible. But today, we're joined by a superstar MSL, and that's not just my opinion. He's got the accolades to prove it, and he's going to break down 3 things for you. 1. What an MSL actually does. 2. The key skills that hiring managers are looking for in future MSLs. And 3. How to stand out in your interview. So, if you're looking to become an MSL or be the best at it, this is the conversation you want to be a part of. All right, well, thanks so much for joining us, Amit. Now, your journey to becoming an MSL took 12 years, but once you became one, it took you only 18 months to win 2 top-tier awards. The first one I was actually present for, and I saw you receive your accolade. It was the Prime 2022 MSL of the Year.
That was right after you, David.
Recognition as Best in Australia. And then the second one that you won was Rookie of the Year, the MSL Society recognition globally. So Best in the Globe. So yeah, phenomenal. Know obviously a lot about how to be a successful MSL. In 2025, Amit, what is an MSL in your mind?
Look, so firstly, David, thank you for having me on your on this video. It's a really great pleasure to talk about my experience in becoming an MSL, and really to your question, what does an MSL in 2025 look like? So traditionally, as we all know, MSLs are scientific experts. They're custodians of the in-field medical affairs activities. So that in my opinion, that will never change. That will always be there. So in 2025 or in 2030 or 20 years down the line, it will still be the same. So that won't change. But what is changing, and what I have seen the change that's been happening, because MSL role is one that keeps evolving pretty much every day. So one of the key things that would change for what I see in an MSL in 2025 is having those digital capabilities and having those the strategy thinking mindset. So as MSLs, we get trained as being experts in the field, going out and speaking with our clinicians, with our KOLs, and getting those insights and bringing those insights back into our internal stakeholders to drive that medical strategy, drive that medical plan. But in 2025, a lot of that responsibility will fall on the MSL shoulders, and that's because you have to be strategic. Because if you're not strategic out in the field, how are you going to gain those those insightful insights? Because if you know the strategy quite well, that's how you would really go about achieving those those great insights. So yeah, so that's number one, being strategically focused. And I think the second one for me, which obviously I've got personal experience in that, but I've also seen a number of MSLs, new MSLs, old MSLs, what they've been doing in recent years is developing those really phenomenal medical plans, right? I mean, when you look at job responsibilities, medical planning usually sits with either medical managers or medical advisors, but things have changed, times are changing. So MSLs have becoming more and more intuitive in developing these medical plans, and I think it's a great skill that every MSL should really have, because at the end of the day, you need to understand, as MSLs, you execute those medical plans. So how good it would be if you develop those plans, obviously in liaison with your senior, with your managers, with your senior internal stakeholders, everyone. And then you go and execute that. So that really becomes a breeze, right? So these would be my two key skills that an MSL in 2025 would be looking like.
Yep, super. Yeah. Thank you for sharing that. And this might be a little bit controversial, but just on the topic of, what key skills are necessary to make a successful MSL, how important is PhD, MD What's your thoughts on that?
Yeah, look, that's a really great question, David. So with all this, when I was working towards getting myself into medical affairs, becoming an MSL, one of the key criteria I came across was you need to have a D degree, either a PhD, either a MD, or one of those strong doctorate degrees. And obviously, this was I didn't have it at the time. And so my aim was to get that because I was so determined to get into medical affairs and become an MSL. And so I went ahead and did a PhD. And right after my PhD, I did a postdoc for a very, very short span of time and straight got into medical affairs. And look, I have to say, PhD is very important because it provides you with that training. Because in research you go through a number of different things. One of the key things that research during your PhD training will teach you is your presentation skills, which is one of the core requirements of being a good MSL. So I definitely have to say, I developed all those good presentation skills during my PhD training, and that really helped me in my MSL career and actually winning those two great awards. Yeah.
Okay, so yeah, it is important.
I would say definitely it's important, yes.
Yeah. I know there's got to be a clear delineation in our industry between commercial and medical, but in my experience with the top two MSLs that I think of who I've seen achieve amazing things, and I can see it in you as well, is they've been able to have quite a strong commercial acumen. I know they stay in their lane as medical. You alluded to medical plans as a really important skill as well for a successful MSL. So my question would be, how important is the commercial acumen tying into medical plans for also being successful in the role?
I have to say one word answer would be absolutely yes. You need to have the commercial acumen because you need to understand, okay, you work in medical affairs, and look, different companies have different ways of working. Some have very strong line or a firewall between commercial and medical, and some companies might be a bit open. I'm not going to say lenient because everything has to work as per our Medicines Australia Code of Conduct. But what I mean by lenient is that there is a bit of trustability between commercial and medical affairs that, we can share things, but obviously off-label will always stay with medical. But as medical affairs, if you don't understand commercial acumen, that where is the drug, where is the product going at the moment, it becomes very, very difficult. Because at the end of the day, you need to understand, you work for a pharmaceutical company. It's a commercial business, and medical affairs is one part of that business that is concentrated on obviously the PV, the patient care, and etc. Related activities. But at the end of the day, it's a commercial business. So you need to have that commercial acumen and commercial mindset. And having said that, you don't have to go and do commercial activities directly or indirectly. That's a no. But it's really about understanding that, because that will really help you to be more successful in your role and understand how the different how the different functions work within your company, and how you can collaborate and liaise with with your other functions. Because one of the things that I learned in the pharma industry is it's all about collaboration, right? Because every single person, every single function has one common goal, which is bettering patient outcomes, but you can't do that alone. You have to do in collaboration with other functions and other people.
Yeah, completely agree. Couldn't have said it better myself. Reflecting on your time as an MSL, I'd love to pick apart, two questions. So the first one, what was your favorite part about being an MSL?
Yeah.
And on the flip side, what was an aspect that you disliked about being an MSL?
Look, a great question, David. So the first question, which is what I liked about the MSL role. So clearly, what I really loved about the MSL role was having those really good scientific interactions with the KOLs, and actually making a difference in some patient's life. being a small part in that journey was very much fascinating for me. And literally that was the one thing that I really looked forward waking up to every morning. That, oh hey, I'm actually seeing Dr. ABC this afternoon, and I'm going to talk about, we're going to discuss this publication, we're going to talk about this, and hopefully, he spoke about this other patient last time I met him. Hopefully that might make a difference for his treatment strategy for this particular patient. So that's what I really loved about my role, and look, that will always be there. It will have a special place in my heart. And then on the contrary, what I didn't like about the MSL role was, look, it may not be directly to every MSL role, but I think it's the place where you work and the teams and everything. I think it was, going back to my point, it was about that, that firewall that you have with your commercial colleagues. I guess in my opinion, if you ask me, it always, trust is the main thing. Right? If you work with your colleagues, from commercial teams, marketing teams, if you have that trust between the two of you, I think that works really. That would work really well. Again, obviously, insights, off-level insights stay with you. But I think, like how we in medical affairs need to know about commercial acumen, commercial mindset. In the same way, commercial teams need to know about off-label items. You have to have that trust that, okay, have to make very much clear that you cannot talk about these off-label interactions externally, but I think it's good for their information, because it's kind of like they're developing a medical affairs mindset themselves. Right? They're really skilled in their commercial activities, but if you can help your commercial colleagues develop that medical affairs mindset, that's great. That's how it should work. So I think that's the kind of that's one of the things I didn't enjoy in my time being an MSL. But like I said before, it could be different for different places for different people. But I'm just sharing my experience.
Yeah. No, I appreciate the honest insight, and I'm actually surprised that it was not an external dislike, because often I ask myself, do clinicians actually know what the difference between me coming in as the salesperson and the MSL coming in? And I know some MSLs have expressed their frustration to me, like they just think I'm from the pharmaceutical company.
Yeah.
Yet I'm also a representative, even though I'm not in sales. But there's just one of the biggest challenges is they're never going to trust me because I work for them. And I don't know if you got to experience that, or maybe they even talk down on you sometimes.
No, I think the experience I had really was one where the clinician, if you put yourself in the clinician's shoes, in your KOL's shoes, I don't think so they understand much of some do, but most of them won't understand the difference between an MSL and a sales representative. I think for them it's like, okay, I'm meeting someone from company ABC or XYZ, but whether it's an MSL or sales representative, I really don't think they care much about. I think at the end of the day, what's important for them is, okay, I've got a patient, I've got a tricky patient, and I need to get this patient on this drug from this company. So I'm going to talk to someone, whether it's an MSL or it's a sales representative, and I'll try to do the best for my patient. So I think that's where they come from. And I think what's important is you have to put yourself in their shoes and understand, what's important for them. Right, so I think that's my experience. I've come across, externally, not many people really see much of a difference, but obviously there are differences internally. But look, I think it's working with your commercial colleagues and your representatives, and doing the right thing, and helping the clinician achieve their goals for their patients' treatment.
Yeah, completely agree that collaboration to synergize. Now guys, if you're wondering how much an MSL makes, I've made a separate video on that. Click the description below, there'll be a link there, and check out the video there. Now Amit, let's fast forward to today, where you are now as a medical affairs manager. You've got direct reports, we talked a little bit off camera, you've got quite a large team under you.
Yeah.
You're also a medical affairs lecturer at the University of Sydney. So the next two questions, I'd love to lean on your expertise in those two sort of functions.
Yeah.
For someone just starting out as an MSL, how can they overcome common challenges like gaining access to HCPs and building trust?
That's a great question. So one of the key things which I've learned in building trust is you need to understand your HCPs and your KOLs, right? You put yourself in their shoes and you understand what is it that they really want, okay? You may have, a newly published clinical readout or a publication that you want to go and discuss with a clinician. But hey, the clinician might not want to be, he doesn't want to listen to that, right? I mean, he's worried about his patient. He's like, okay, how do I get access to this particular drug which is, not on the PBS, it's just TGA approved. Is there a compassionate program or what? I think it's really working with them, understanding what their goals are. So that's how we really develop the trust. And I think it's, if you sort of come out of the pharma industry, even in day-to-day life, with your friends, with your family, with your children, I think it's really about understanding what is it they want. You got to put yourself in their shoes and really help them, make it easy for them. Okay, look, I understand. I'll make it happen for you. I guess that's the best way to earn trust, and it goes a long way.
Yeah, couldn't agree more. I think if I build on what you've shared with us, the first point around gaining access and leaning on mentors, collaborating, I think of my marketing mentor, my most recent one, and a lot of them have started in field-based roles, and he talked to me about the customers who he used to call on as oncology trainees who are now all heads of department, and he's like a head of marketing and things like that. So, even he's like, oh, I'll introduce you to this oncologist or whoever it may be. Exactly. So you never know. The second piece on building trust was leading with the need. And I remember very early on, I was a little bit of a sales geek and reading all the sales books, and they talked about not selling beef sausages to a vegetarian and how you uncover that they're a vegetarian. And I think to your point, it's just because you're an MSL, don't go in there and think, oh, they just want to know about the latest clinical data that's come off from this big conference. To your point, maybe they just want to know, I want to access this drug. I could not care less about what's just come out at TSANS, USANS, ESMO, ASCO. I just want, help me with this, and you need to find that. So I think that's a really good point. My final question is, what can those with no experience or rookie MSLs looking for maybe a more senior MSL role, what can they say in an interview to convince a hiring manager like yourself to give them their first job?
Yeah, look, that's a bit of a tricky one, David. Obviously, different people have different sort of criteria and what they expect from the people they hire. So look, I think one golden rule that anyone, experienced MSLs can talk about is the number of experience across different areas, right? So obviously, as MSLs, you do a lot of field activities, you gain those beautiful insights and drive the strategy. But what about, have you got experience in, say, working with the patient support program team or developing a patient support program, or a little bit in marketing? Have you come across developing some materials, medical materials, or overlooking commercial materials and approving, or working with your marketing teams to develop them and make them more appropriate and more medically compliant as well, before they go out in the field. So that's one area, can be quite beneficial. So I think for me, one of the key things that I would look in an MSL if I were hiring an MSL would be, okay, what are the different areas you've worked in, right? I mean, I understand, you may have experience in an MSL or have a great understanding of the MSL role, or both. I completely agree and hands down to that. But what else can you do? Because as a manager, like in my role as a medical affairs manager, I look after medical affairs, but I also look after many other different things, right? So if I have someone who I can lean on to, well, that's, you're hired.
Yeah. So bringing in, maybe to summarize, it's showing what you can do, obviously in the MSL role, but what are some additional strings on your bow that could add value to the role, and where could you wear potentially another hat? Yeah.
And I think it's good for yourself as well, because the more different skills and areas you've worked in, it sort of opens your mind. And sometimes you may join a company or organization in medical affairs, but I've seen people move out of medical affairs and they've gone to marketing, they've gone to being a business unit head. I think it really opens up your interest. You would think, I think I'm better at marketing, so I might move at marketing. But you wouldn't be able to do that if you didn't have experience, if you didn't get exposed to that. So I think that exposure is very important, because pharma again is one of the spaces where you have multitude of functions and areas where you can work. So it's really about developing that mindset, having that open mindset, and saying yes to yes to not everything I'd say, but yeah, to things that you really would help you in your future career and develop your skill set well enough.
Yeah, exposure to different functions is
Absolutely.
what I'm hearing. Yeah. Sadly, the YouTube algorithm only respects engagement, not our transformative advice, but you can change that. If you've taken value from this session, please give the video a like. It shows great support for Amit and helps the channel and us grow the community. So we've uncovered what makes a top tier MSL. But what happens when AI starts reshaping the industry? Well, Amit has actually built a number of game-changing applications at the forefront of AI in medicine. Don't get left behind, click here, or you'll miss how AI could redefine pharma jobs, including yours.